But I don't know whether any of you saw a picture yesterday that was doing the rounds of one Gary Lineker. You might remember Saint Gary Lineker. This is the guy who works for the BBC, gets paid almost £2 million a year by the BBC, and of course thinks that entitles him to have a view on almost everything under the sun. He, of course, is completely and utterly exempt from the new rules of the BBC, which suggest that if you are a BBC presenter, you should really not be giving out your views on politics, because the new Director General, Tim Davie, has actually said that. He's also said that Gary Lineker is exempt from it. Picture of him on the front page of the Daily Star, it was out on Twitter last night, of Gary Lineker in a shop wearing no mask. Now, this wouldn't matter, mostly, to most people, were it not for the fact that he tweeted out on July the 14th, "Why would anyone object to wearing a mask in a shop? It's not exactly a hardship. What a country of snowflakes we have become." Here's the picture, in case you haven't seen it. You can see he's very clearly standing in a shop without wearing a mask. Now, I'm not going to give him a hard time for not wearing a mask, because some people don't like wearing masks. However, most people who don't like wearing masks don't tell everybody else to start wearing one. That's the hypocrisy of the man. By the way, has anybody noticed that even now, some months after making his first pronouncement about adopting an illegal migrant, an asylum seeker, somebody coming on a dinghy from France, he still hasn't managed to find one? He still hasn't managed to actually get the process sorted out so that he can, in fact, house an illegal migrant. All he's got to do is pop down to Dover, where we are told there are still hundreds and hundreds of people arriving every single day. But Gary somehow hasn't managed to find somebody. He hasn't managed to identify anyone, and he hasn't managed to house anyone. So maybe it was all smoke and mirrors after all. Maybe it was all just virtue signalling. Could it be, Gary, that is the case? I'd like to communicate with Gary Lineker about this, but of course he's blocked me on Twitter because I asked him about whether he was paying a reasonable amount of tax on the earnings that he made from Walker's crisps, while telling everybody that they should eat healthily, of course. Here's what he said yesterday after he was found out walking around in a shop without a mask on, which is technically an offence, right? "In my old age, I went into a store," he calls it, a store. Oh, you're American now, Gary? "Went into a store and forgot to put my mask on." Forgot to put his mask on. "Was wondering why people were giving me daggers. Realised after a couple of minutes and hastily put it on. Felt awful and embarrassed. Apologies to those present." Well, I'm sorry. Apology not accepted, Mr. Lineker. If you're going to start being a hypocrite, then an apology is not going to be enough. I think you should make a very large donation to a charity of my choice. That's what I think you should do. And when on earth are you going to do what you said you were going to do, which is to give some shelter to an illegal migrant? Because it's now looking like it's never going to happen, I'm afraid. What an absolute plank. Let's talk to Richard in Lee. Hello, Richard.
Hello, Mike. Good morning.
Good morning. What can I do for you?
Well, I've been hearing this morning the frustration of people with lockdown, tier 1, tier 2, tier 3, whatever. I mean, it's all gesture politics.
It is.
Now, I know a bit about outbreak. I've worked in environmental health. I'm an environmental health practitioner for the last 30 years. I've done more outbreaks you can shake a stick at. And the mistake, I mean, big mistake, monumental mistake that was made was on March the 12th when they decided, because of sheer weight of numbers and they just couldn't cope, was contact tracing. And anybody that knows anything about epidemiology, outbreak management, whatever you want to call it, knows that you've got to get contact tracing properly up and running. And it's the last thing that you would abandon. And the reason for that, and I'm going to be a little bit technical here, the reason for that is because we developed the pandemic response way back in the swine flu days. Remember that?
Yes.
And there's a group called SPIM. They come up with the statistical modelling for viruses like this, like we've got now. One of the things they have, and it just shows what an inexact science it is at the best of times, they have a process called FF100. And FF100 stands for first few hundred.
Okay.
Now, what that basically means is you've got to get all the details you can for the first few hundred cases. First few hundred, you can say 500, 600, 700, up to 1,000 cases to be able to form policy. Now, the problem is, March the 12th, when they abandoned it, the number of cases was 167. So that's not a few hundred.
Yeah.
And every policy decision that's been developed since then has been based on that pitifully few numbers that we've got there. And of course, what you get is a policy is made. We will have this national lockdown. It actually started on March 16th, but it was announced on March the 23rd.
Yes.
Every business closed, couldn't go to work. The police were interpreting it in their own way. Remember the hours exercise we were allowed to have and that malarkey.
Right.
And so everything else after then has been based on that. So and that was incorrectly done because of the sheer lack of data that there was.
Right.
So I'm really frustrated when it comes to people criticising Andy Burnham, and I'll declare an interest. I don't share his politics. We know each other very well, but, and we know that we don't share each other's politics. But he's absolutely right. He was at the sharp end of the swine flu outbreak. He helped to develop the influenza response that we're using now to develop the.
But what is he right about, though? Because I'm not sure what it is that he's after. Because we know that he wants to get money for people and business, which I think is the right thing to do. But by the same token, he also wants to lock down.
Yeah, that's what he's right is his analysis, that he's actually agreeing with some of the scientists that have come out and said, look, tier 1, 2, 3, it won't work. You need something far more draconian.
Yeah.
Now, the thing is, yes, draconian things do work, and they did work during the big national lockdown simply because you're keeping people prisoner in their own homes. But that's inhuman. You can't do that.
No, and it's not sustainable either in the long term.
You do it to create space. You do it to create space, to get the NHS ready, build the Nightingale hospitals. And that's the bit that he can't understand and I can't understand, that the whole reason why we all went, and we all agreed by and large, to go into national lockdown back in the spring is so that we could prepare. But we're prepared now. And what really frustrates me, because I live in Greater Manchester, what really frustrates me, and you can see it as plain as the nose on your face, that there's a lot of Manchester-focused news reports at the moment saying how the hospitals are filling up, the cases going up. Now, the answer to that, bluntly, is of course they are. There is always a second wave. When you look back in
but also, Richard, there's also no suggestion, Richard, that it's any worse than it was this time last year either.
No, and that's the second piece of frustration. Just to finish off the first piece is, we've prepared now. We've got Nightingale built. No, we know more about the virus than we've ever done.
Yeah.
We are closest to a vaccine. But the second frustration is that the statistics being put out now to say, the ICU beds are nearly full. And that's correct. The ICU beds are nearly full, but they nearly fill every year. So this is nothing statistically significant from what's happened in other years. Right. And in any case, you can open up, and personally, I think Nightingale should be opened up anyway. You open up Nightingale hospitals, you're freeing up the hospitals.
Well, there's not much point in. Well, exactly. There's not much point in complaining that we haven't got enough capacity when you have, but you're just not using it.
There's no point in preparing building all these Nightingale hospitals because the government knew the second wave would come, because any scientist would have told them, whatever you do, the second wave will come. Whether you can have tier 4, 5, 6, up to 100, the second wave will come. That will always happen. So the most you can do is actually what they've done, is prepared and said, right, it's coming. There will be an increase in deaths. There will be an increase in cases. There will be an increase in positive tests. But the thing that we can do is prepare for it, to make sure that people are properly looked after, people are properly shielded, and protect the most vulnerable. But what they're doing now is gesturing. They're looking busy because they know, they would have been told the wave is coming, it's going to hit. And what any government, whatever colour, doesn't want to do is to be sat there thinking we can't be seen to be doing nothing at this stage.
No.
Because then we're accused of not helping
I just wish they'd be more truthful. Richard, listen, fascinating, all the things you're saying. I'm going to let you go, though, because we're running late. But thank you very much for that call. Very informative, very interesting, and very true as well. The bottom line is that I just want the government to not try and pull the wool over everybody's eyes, not try and frighten people, not try and scare people with statistics. Because my point about the statistics is that you can interpret statistics in any way you like. If you were to say to me that 82% of the critical care beds in Liverpool were occupied, that might sound scary. But when somebody then says, but that was the same as it was last year this time, and the year before, and the year before that, and that's basically the average occupancy rate of clinical beds, clinical care beds at this particular time, critical care beds at this particular time of the year, then that puts it all in a very different perspective, does it not? And that's my point. 0344 499 1000. Loads more coming up on Talk Radio.